What happens when you're in control of your finances, your career, and your well-being? There's no limit to what you can achieve. I'm your host, JaeVic, bringing you on a journey through finance, fitness, and finesse. A podcast about developing your 8 dimensions of wellness. If you're looking to elevate your wealth, well-being, and discover the power of balance, join me bi-weekly, Mondays and Fridays, to learn why money matters, but wellness counts. Hey finessers! Welcome back to Fitness Finesse Fridays, where we relate the crossroads of your finances and your well-being. I'm JaeVic, your guide on this journey to elevate both your wealth and wellness. Today we're touching on a topic that hits close to home, the mess that is the US healthcare system. I had another episode planned, but recent events in my life pushed me to address how this system seems almost designed to confuse us. There's so much to cover on the subject, it could honestly be its own season. I'm going to keep this as concise as possible to help my fellow young adults avoid the same mistakes I've made. Before we start the show, if you're a returning finesser or listening for the first time, it would be lovely if you could leave me a 5-star review. It helps our community grow and gives me a heads up on how to make things even better. I appreciate all feedback and of course constructive criticism. I also want to give a shout out to an exceptional finesser who let me know in the last Savvy Sunday Scholar episode that there was a little bit of dead air. I spend a lot of time recording, editing between my multiple jobs, side hustles, being a student, and trying to have some sort of social life and well-being. So yeah, I'm probably going to make mistakes in these episodes. Now, I know there was a lot of people who listened to the episode before that finesser let me know that there was a problem. So, am I salty? No. Yes. No, I'm not. But I really just want to thank that finesser for letting me know so I can make an adjustment, because I want to deliver high quality content to you guys, but I'm going to make mistakes. So when I make a mistake, please let me know. Okay, let's get into it. I've had my fair share of run-ins with the healthcare system. This year, I've been dealing with bills that sneak up on me months later. I pride myself on being organized and on top of things, especially my bills. I've been really frustrated by the lack of transparency with providers and insurance companies. And trust me, I like to ask questions. This is a public service announcement for my fellow young adults that are thinking or trusting you can just walk into a doctor's office with private or student insurance and have everything covered. It's not that simple. I've made mistakes, and I'm still fighting to fix them. But if I can help at least one person avoid the traps I faced, then that's a win in my book. 'Cause let's be real, the anxiety that comes with unexpected bills is awful. I competed in boxing in high school at an all-male gym, and sometimes the gut or kidney punches I would take there are a lot more manageable than these bills that come out of nowhere and sucker punch me. Many Americans are tired of the lack of transparency in medical pricing, surprise bills, and the skyrocketing costs. Who isn't anxious about whether we will be able to access the care we need, and when we need it, that worry should not have to hang over our heads. In 2023, a national survey conducted by the American Cancer Society and partners found that 1 in 3 Americans struggle with the weight of medical debt. Nearly 7 in 10 U.S. adults say they receive medical bills they cannot afford, and many of them are forced to delay paying these bills, put them on a credit card, or try to challenge them in hopes of reducing the cost. It's a vicious cycle that seems never-ending, just like with other kinds of debt. Here's some numbers from that study that should catch your attention. 74% of those with past or present medical debt have experienced negative impacts as a result. Surprise! More than 4 in 10, or 42%, delayed medical care because they didn't want to go further into debt. And 1 in 5 avoided going back to the same provider where they owed money because they feared they wouldn't be treated. And lastly, 1 in 3 people reported being more depressed or anxious due to their medical debt. Medical debt is not just a financial burden. It's a mental and emotional one too. It's a modern-day crisis affecting millions of Americans, leading to delays in care, worsening health outcomes, and lingering feelings of hopelessness. How is it possible that a 15-minute conversation with a doctor, or in my case, a dermatologist, can set me back over $300? Don't get me wrong, I know you had to pay a lot for medical school, but you are not worth $300 to talk to you for 15 minutes. It's a straight up robbery, and I completely get why people avoid going to the doctor, especially young people. Take Alec Smith, for example. He was only 26, from Rochester, Minnesota. Alec had just aged out of his parents' insurance and couldn't afford his insulin. He tried to stretch his supply until his next paycheck, but it wasn't enough. Alec tragically died alone in his apartment, suffering from diabetic ketoacidosis. I hope I said that right. A condition that never should have happened. This is heartbreaking and horrific because while Alec's story has a devastating ending, it's not an uncommon scenario. He was trying to stretch his medication because he couldn't afford it. Bottom line. Nearly half of Americans delay or skip medical care due to high costs. When people avoid going to the doctor or are misusing their prescriptions, it can lead to later stage cancer diagnoses and fewer medications being taken. Our health continues to suffer and lives keep being lost. And you know what? People, we have a right to be angry. Sure, allowing pharmaceutical companies to set high prices for life-saving medications has been a recipe for disaster, but the problem goes beyond just greed. Even if the US cut every pharmaceutical price in half and eliminated all profits from health insurance, we'd still be spending way more on healthcare than other first world or wealthy countries. I've talked with some international students on campus that have called America the third world of the first world countries. Sit with that for a moment. Let me share a personal experience. I've struggled with eczema my whole life, dealing with allergies and horrible skin sensitivities. I've got eczema, and while it's funny, it's not funny. It's really been a pain to deal with for 23 years. Winters in the Midwest are brutal on my skin. This past winter, I could not hold out any longer with my home remedies and over-the-counter care. Over-the-counter is non-prescription meds for those who don't know. Like a good young adult, I called my insurance to find a dermatologist in-network so I could get the financial support I thought I would get from my benefits. In-network means a healthcare provider or facility has a contract with your insurance company resulting in lower costs or a discount for you. The dermatologist I visited gave me a prescription to help me with my symptoms, but it came right before a spring break trip. I didn't have time to compare prices at different pharmacies, find coupons, or make endless phone calls to find the best deal. You know, the game. Shout out to GoodRx, you do help a little bit, but it's still a game at the end of the day. I was tired of being in so much pain that I just took the quickest option to get the meds, even if it meant spending more. The lack of regulation around medication prices preys on our pain and desperation. It forces us to choose convenience over cost, often to our financial detriment. Luckily, I had savings to cover this cost, but doesn't mean it still hurt. Didn't hurt as bad as my skin, which the meds thankfully did help. Regulating medical prices could alleviate so much of this stress. It could free us from the constant calculation of whether we can afford to care for our own health. And it's not just about cutting costs. Americans have the right to live without the constant fear of financial ruin from a doctor's visit or a prescription. A harsh truth? Insurance is a business before it's a wellness service. I'm open to debating that with anyone who wants to bring that on. But the high cost of medical care is one of the biggest challenges that this country faces. You can't deny that. And it impacts everything from the overall economy to how we behave as individuals. In the May 2020 issue of Harvard Magazine, David Cutler, a professor of the Department of Global Health and Population at Harvard T.H. Chan School of Public Health, introduced three main drivers of overpriced healthcare costs: administrative expenses, corporate greed and price manipulation, and the higher use of costly medical technology. Cutler explained how administrative costs are a nightmare with all the paperwork and complicated procedures involved. Add on corporate greed and price hikes showing that, for many, making money is more important than caring for patients. And the use of expensive medical technology, while often life-saving, can also drive up prices sometimes unnecessarily. It seems like insurance is designed to be confusing. HMO, PPO, blah, 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 ugh. It's like they're speaking in code. But it's Friday, and we're not here for too much financial jargon. That's for another More Money Mondays episode. Instead, let's talk about some harsh facts from around the world. Since it's Olympic season, let's put it this way. When it comes to our healthcare system, the US is barely qualifying to show up compared to other countries. The United States has a ton of issues when it comes to medical care. Nearly 10% of Americans are still uninsured, and we have one of the lowest life expectancies in the developed world. And what's the common theme here? The ridiculously high cost of medical care. We can't guarantee adequate access because we haven't figured out how to pay for it. Is it a budget problem or a priority problem? 2/3 of Americans think the federal government should step in and regulate medical prices. The public's view is clear. We see the problem as unconstrained greed. Big Pharma prioritizes profits over patients, and insurance executives rake in millions while denying coverage. Big Pharma refers to the large pharmaceutical companies that make and sell medicines and treatments. The U.S. healthcare system has been criticized for various forms of corruption, which can manifest in several ways. Starting with the pharmaceutical industry influence, these companies often hold massive power in the healthcare system. They engage in practices like price exploitation, and sometimes they even may pay physicians to promote their drugs. What do you think this leads to? Overprescription, or pushing more expensive meds over cheaper, equally effective alternatives just for personal payout incentives? Medical billing fraud is another issue. It includes things like charging for more expensive services than were actually provided, doing unnecessary procedures, or billing for services that weren't done. Have you ever gone to the doctor and some people have said, man, it just seems like they just want to cut me open. They just want to do surgery on me. I wonder why. This kind of fraud raises healthcare costs and puts more strain on insurance systems, which, again, leads to higher premiums for patients. Premiums are the regular payments you make to an insurance company for coverage. It's like your monthly or yearly bill that you pay to insurance. Again, I'm frustrated to highlight the lack of price transparency in healthcare that makes it nearly impossible for patients to know the actual cost of services and procedures. This leads to surprise billing and inflated costs, since we're often unaware of the prices until after receiving the bill. And let's not forget about conflict of interest. Some healthcare providers receive incentives for referring patients to certain facilities or specialists, regardless of what's actually in the patient's best interest or insurance coverage. To sum up, this is a cycle, and the surprise bills seriously mess with people's financial health. With so much money going towards healthcare, there's typically not much left for other goals like paying off debt, buying a house, or saving for retirement. High costs often make people put off or skip needed medical care, which just makes their health worse because they have fear that they're going to be financially destroyed. Dealing with medical debt also impacts our mental health, causing anxiety, depression, maybe even some PTSD. The trickle-down effect of the healthcare system prioritizing profit over prevention leads to less focus on public health and education. All this to say, I have family members that are doctors, I have friends who are going out into the healthcare industry. I was going to work in the healthcare industry as a social worker, and I'm not saying that every single person in healthcare, insurance, pharmaceuticals is a bad person or a bad professional. It's the system we need to look at. But all that to say, do not be afraid to ask questions. Continue to get the clarification you need on something you're confused about. You do not look stupid, and you are not stupid because you had guts to ask. Corruption is paid by the poor. Pope Francis. Did you know there are ways to challenge a medical bill? Unfortunately, most people don't know how to finesse your way out of unexpected insurance bills. 7 in 10 U.S. adults have never challenged or appealed a medical bill, and nearly half don't even know that providers offer financial assistance. This lack of awareness is more common among people of color and younger patients. Raising my hand here. What you really should be aware of is that when you go to the doctor, most of the bills are based on a diagnostic code. These codes are used by healthcare providers to submit claims to insurance companies. The diagnostic code represents the reason for your visit. Now, you can't see me, YouTube channel pending, but I'm doing air quotes because the code might not always be accurate. These codes can determine what your health plan covers and how much your provider that gave you the treatment gets paid. Think of the provider as your doctor or the facility, in case you guys haven't picked up on that. You can usually find the codes on your explanation of benefits, also known as an EOB, and medical bills. Earlier this year, I sought services from a provider that was in my network the previous year. Naturally, I assumed they were still in network and thus covered by my insurance. I mean, who checks every single time they go to the doctor? Well, turns out they were no longer in network, and due to incorrect coding, I received a massive bill that haunted me for months. I had to politely but firmly advocate for myself, making several calls and even writing a letter to the provider explaining how paying this bill would mean I couldn't afford groceries or gas for over a month. After much patience and persistence, I got the bill waived. Financial forgiveness is possible, but it requires a fight. I mean, the squeaky wheel gets the grease, but why do we have to fight so hard in the first place? In the show notes, there's a link to help you understand insurance codes so you can avoid surprise bills like I did. Just a heads up, don't bother asking your insurance for the right codes. They typically won't give them to you. And trust me, I've tried. However, some providers might share them if you ask. I've even heard stories of doctors or therapists putting in a different diagnosis to help a client, knowing their insurance wouldn't cover the actual diagnostic code and the client couldn't afford the care otherwise. There are providers out there who will try to look out for you. Doesn't make it right that the provider may have to lie to help you, but hey, you gotta work the system when you can, I guess. Bottom line, US adults are ready to hold the government accountable if they don't bring down high healthcare costs. But even if we get that accountability, will there be any real action? Do we really have a voice in this system? It is becoming harder and harder to be faithful in true change, be faithful in our government. Some say the system is too big to reset. Others think it's not a priority. And some argue there just aren't enough government funds to make a difference. Whatever the reason, and there are many, our frustration, anxiety, and anger are valid. There are a lot of voices out there calling out the injustices and leaks in our system. The system, as it stands, prioritizes profits over people. America is a business after all, and it's designed to make money, not necessarily make us well as a country. Americans have the right to live without the constant fear of financial ruin from a doctor's visit or a prescription. But here's the thing. As woke as many think they are, most of us are broke. Not just financially, but in our spirits too. If we're going to be angry, let's at least understand why we're angry. Identifying the root causes of our anger can help us take purposeful action to find solutions and drive real growth. Stay tuned, keep fighting to finesse, and let's turn our collective frustration into a force for change. Alright, finessers, that's all for today's episode of Health Doesn't Care. Key takeaway of the episode is the US healthcare system's lack of transparency and high costs leads to more than financial stress. It impacts our entire well-being. So we need to stay informed and proactive in managing these expenses. Being a lifelong learner gives you a leg up because you're able to engage in things that can help you stay ahead of the ever-evolving system that we are forced to live in. If you found today's episode helpful, please share it with a friend or family member who could benefit from this knowledge. And don't forget to give me that feedback and hit subscribe and leave a 5-star review so you never miss an episode of Fitness Finesse Fridays. Got questions or topics you want to know more about? Hit me up on social media or drop a comment. Until next time, I'm JaeVic, and I'll see you on the Savvy Sunday Scholar for part 2 of Eating Disorders and Money. And if you don't know, now you know. Disclaimer, this podcast is for informational purposes only and does not constitute financial or mental health advice. Always seek professional guidance tailored to your personal needs.